It doesn't stop there. Then we move on to our communities where there should be clinics, where there should be great discussions about how do we effectuate a change in someone's quality of life. There should be discussions on zoning laws. Why? You will notice that our neighborhoods seem to be zoned in a way that does not seem to be advantageous to our better health. If you will note that some of our grocery stores do not have fresh fruit, vegetables, produce in them. The only thing that's being refrigerated in our grocery stores in our neighborhoods seem to be an over-sweetened beverage or an alcohol beverage. That it is more prevalent to see cigarette advertisement or liquor advertisement in our neighborhoods. It's more prevalent to see a situation where a sedentary lifestyle is more advanced. Why? Because we fear going outside, because we do not have the property tax available to show up the financial infrastructure to have police patrols in our neighborhood. That has an effect on your quality of life, mental health, physical health. Zeta has always taken the lead on great discussions. We started as far back as our 35-year relationship with the March of Dimes, where we continue to lead the way. The March of Dimes was an organization founded by a president. President Franklin Delano Roosevelt founded the March of Dimes. And in their first 17 years of existence, they battled and defeated polio. Now we march on with them to advocate healthy babies and to advance the cause of prematurity awareness. We hope that you will continue to fellowship with us as we move forward for our Prematurity Awareness Month in November, Prematurity Awareness Day, November 18th, Prematurity Awareness Weekend, the 14th and 15th, and the 21st and 22nd of November. See, it starts from the cradle all the way to the grave. So we're here with our panel of esteemed panelists and guests to articulate what's in the bill, what's not in the bill, and how you can effectuate change. Is there a death panel? Well, we hope that Brother Legislator can explain to us that there is no death panel in a 1,502-page bill. No one can seem to find where this death panel is. And if you are here and you happen to work for Aetna, we'd love for you to come forth and explain to us, why is insurance so expensive? Why is it that some people can have it, some people cannot? Do you want a public option? Or do you feel that there should be a right to not have insurance, but then how do we pay for the person who believes they should not have health insurance but have the opportunity to go into a hospital? We also discuss on an international level, because we are an international organization, one of the first organizations to charter chapters in Africa, one of the most diverse sororities, even though we're predominantly African American. Our members are also Filipino, are also Caucasian, Eastern European, are also Middle Eastern and Latinas. So we're here to discuss on an international level. We do not call people illegal immigrants at Zeta Phi Beta. We call them guests who have stayed and will continue to stay. We want to have some fun with this discussion. As women, we want to hear a discussion about how do we effectuate a women's clinic. You're inside of a building that can house a women's clinic. As women, we know that we have to remain healthy for all of our families to be healthy, because it's usually the woman that juggles everything, that juggles being a mother, but also being a businesswoman, also being college educated. She's the woman beside the man. So when she's not healthy, then the family is not healthy. So as women, it is our duty to know, well, do we need the vaccination for the H1N1 situation? Do we need to vaccinate? Or do we listen to stories where you say, well, okay, you can get autism from a vaccination? But those discussions have to be had. Secondarily, discussions have to be had on a sexual level. AIDS, HIV. Zeta has now engaged in a partnership with the CDC, where I will be tested wherever I go. Now, I have to go to my own doctor to get tested first. I don't want to fall out on the first test. They put me in the room on the side. But if you don't have the availability or the opportunity, some of us can't go to the hospital. So there should be a clinic in your neighborhood. When some of us were growing up, we went to Planned Parenthood, where we may agree or disagree with Planned Parenthood. It was an option for us. So that option to go somewhere and be tested for HIV and AIDS should be there for the community, because there are other diseases, syphilis, gonorrhea, chlamydia, HPV, that we need to be tested. For our men need to be able to have a place to go to discuss their mental health, their physical health. You know, when you have African American men dying of prostate cancer because they fear being tested, it is our duty as women to take our men and have them be tested. So we hope that today, that our panelists will help us have a discussion that we can go forth and then get on the phone, fax, email our representatives, our senators, our congressmen, because the battle we hear will not be in the House so much so, but in the Senate. So the representatives, the politicians who seem to depend on our vote need to hear what we do. As a nonprofit organization on an international level, we are not taking a side. We are giving information. And we feel that it is our duty to wake up on a Saturday morning. It's maybe a little gray, maybe a little wet, but there's sunshine in this room because there's now a ray of hope that we will go out empowered to instruct, to give information, to say, okay, if this is what you want in a bill, tell your senator, tell your congressman. And if they do not vote the way you need them to vote, you must remember that on election day. So please continue to fellowship with Zeta Phi Beta Sorority Incorporated. We notice that some of our brothers are here from Phi Beta Sigma. We applaud our brothers for always walking with us on a journey toward empowering people. That is what health and justice is all about, to build coalitions with other organizations. It's not just African American people who need to discuss healthcare reform. We need to discuss it with all Americans. It is our right to have a discussion. And even as a nonprofit organization, we don't have to be silent because we have nonprofit status. It is our duty to speak up and take the lead. So I hope that we can have some fun here today. If you have questions, I'm sure they have some cards where you can write your questions down. And we want the world to know this is not what you're going to see on TV. It's not going to be people screaming at each other and yelling and getting angry. This will be a dignified, civil discussion on healthcare reform. Why? Because we as a people will always have dignified civil discussion. And then if we get what we want, a healthy people is a prosperous people. If you are not healthy, you cannot work. If you cannot work, you cannot pay taxes. And if you cannot pay taxes, you will not have a voice in the structure of this great nation. So this morning, not only do I bid you a good morning, and I applaud my dear Saras for organizing one of the first town hall meetings in this area. So Madam State Director, all the officers of this area, we look forward to fellowshipping with you. And if you can go to Boston, where the next town hall meeting will be, and if you can make it to Baltimore, where the town hall meeting will be held at the Atlantic Regional meeting, where everyone from the Atlantic region will come together. We hope that you will continue this discussion with us. With that said, Madam Presiding Officer, I will step aside and allow you to preside over this August body and hope that we will have a very productive and fun discussion. Good morning. Good morning.